Hey everyone, the title of the video itself explains what the video is going to be about, and I'm sure you are going to realize its importance by the end of the video, or maybe after getting a gold medal in anatomy. You are free to take screenshots of the slides and ignore my talk, but I would suggest you hear me out as I'm going to garnish these topics with some extra advice and tips as to how some of the answers must be written to get the best marks. So, without getting much into your nerves with such a long introduction, let's start. Medial medullary syndrome. Well, this topic didn't deserve to be written separately as it is such a tiny topic and would be asked for 3 or 4 marks type of short notes. Next is floor of fourth ventricle, a very important topic. The structures present in the fourth ventricle, each and every structure is important. The diagram is important, and obviously the clinical correlations need to be mentioned. This can be asked for 10 marks question. Then is circle of Willis. Circle of Willis is a very favorite question for the examiners. They ask about the site where it is present in the brain. The diagram is important, the names of the arteries obviously are important. Then the transverse section of medulla oblongata at the level of pyramidal decussation. The diagram is very, very important, not just a theory. If somebody thinks that just writing the theory will do, uh, the examiner wants the classic diagram of the transverse section. Then comes the transverse section of midbrain at the level of superior colliculus and also at the level of inferior colliculus. Same goes with these two topics also. Diagram is a must. I would suggest to draw the diagram before writing the theory, as it will help you to enhance your theory part also. The subject matter would also be written easily and faster in that way. If you think you'll write the theory first and then draw the diagram, I think it would take some extra time to do that. Personally, I would go for drawing the diagram first and then writing the theory down. Next comes corpus callosum. Corpus callosum is not much of a diagrammatic question, but they ask sometime, and sometimes they are asked for 10 marks question also. Brown sequard syndrome is a clinical correlation, can be asked for 4 marks, not more than that. Inferior cerebellar peduncle, it is also a diagrammatic question. So next is transverse section of spinal cord at the cervical level. Okay, not just at the cervical level, but all the levels like thoracic, lumbar. This is that kind of topic from which you cannot escape yourself from, in especially neuroanatomy, which is spinal cord is the heart of neuroanatomy, to say it in a pun language. But you can never escape from the transverse sections of these things. Next up is internal capsule. The diagram of internal capsule, the placement of various gray matter and white matter is very important. And this is a question which also needs diagrammatic attention. Then is the area numbering of superolateral surface of cerebrum. This is an interesting part. Uh, all the numberings, what are the mm, numerals denoted to which part of the brain, the motor part, the sensory part, the auditory, occipital, everything is important with diagram. Then comes the functional areas in frontal lobe. The frontal lobe is very important, and each and every function of the frontal lobe is asked in exam as a short note, maybe a 10 marks question. Then all the cranial nerves like abducent nerve, vagus nerve, trochlear nerve, these are important with all the cores. Next is the cerebellar peduncles. All the peduncles are important. In the previous slide, I mentioned about the inferior cerebellar peduncle. That is most important of the three. Next is blood supply of internal capsule. It is self-explanatory, nothing to much explain about it. Then is transverse section of medulla at the level of sensory decussation. Again, diagram is important. Wherever there is transverse section, not just theory, also the diagram is important. Dural venous sinuses are very, very, very important. This is a golden topic which examiners love to ask for 10 marks question. And please, please learn to draw the diagram of dural venous sinuses. It is not a 2D kind of diagram, it is a 3D diagram. People who are studying it or who have studied it knows what I'm talking about. Then is ascending and descending tracks. This is also the butter of neuroanatomy. Without this, you cannot proceed of, with any topic, whether it is transverse section or any topic. Next up is superior orbital fissure. This is a very brownie point kind of question. People generally pass, and this is a very easy topic and a very scoring topic. Again, the diagram is very important. One cannot proceed the theory without drawing the diagram and the structures passing through it. Next up is the question which can be asked for 20 marks or 15 marks. And let me tell you beforehand, before discussing these topics, that all these topics must require a diagram in your answer. First topic is spinal cord. All the levels of transverse section, the everything about spinal cord, all the foramens, all the coverings, and all the clinical correlations and the thickenings. Everything is important about spinal cord. About facial nerve is a very tricky nerve. The course is very tricky, the supply is very tricky. Next is lateral ventricle. All the structures in the lateral ventricle, the diagram is important. Middle cranial fossa is the very important fossa because beneath it the ear is present, the internal ear, middle ear, everything is present. And the middle cranial fossa is a very wholesome part of the base of skull. Then comes cavernous sinus. Cavernous sinus is the hit topic. It is going to come in the exam, whether be it your internal examinations or your external examinations like the university or props. Then comes the dural venous sinuses, which I made a mention of in the short notes also. It is a topic which can be played upon very nicely. So that's it with neuroanatomy. Hope it helps. I would upload important topics from other chapters also. So they will be available in my channel's playlist. Do check them out. Thank you.